Welcome to NCLEX PN exam practice test. Our topic today is assessment and physical exam. Use the link in the description to download the app on the App Store for more courses and free practice tests. Number 1. The nurse is caring for a client admitted to the emergency room after a fall. X-rays reveal that the client has several fractured bones in the foot. Which treatment should the nurse anticipate for the fractured foot? A. Application of a short inclusive spica cast. B. Stabilization with a plaster of Paris cast. C. Surgery with Kirschner wire implantation. D. No bandages to be used to correct the fractured foot. The correct answer is B. Stabilization with a plaster of Paris cast. Explanation. A client with a fractured foot often has a short-legged cast applied to stabilize the fracture. Answer A is incorrect because a spica cast is used to stabilize a fractured pelvis or vertebral fracture. Answer C is incorrect because Kirschner wires are used to stabilize small bones such as toes. Answer D is incorrect because the client will most likely have a cast application. Number 2. Which set of vital signs would best indicate an increase in intracranial pressure in a client with a head injury? A. Blood pressure 180/70, pulse 50, respiration 16, temperature 101 degrees Fahrenheit. B. Blood pressure 100/70, pulse 64, respirations 20, temperature 98.6 degrees Fahrenheit. C. Blood pressure 96/70, pulse 132, respirations 20, temperature 98.6 degrees Fahrenheit. D. Blood pressure 130/80, pulse 50, respirations 18, temperature 99.6 degrees Fahrenheit. The correct answer is A. Blood pressure 180/70, pulse 50, respiration 16, temperature 101 degrees Fahrenheit. Explanation. Increased intracranial pressure vital sign changes include an elevated blood pressure with a widening pulse pressure, decreased heart rate, and temperature elevation. Answer C could occur with shock or hypovolemia. Answer B does not correlate with increased ICP. Answer D shows increased intracranial pressure, but not as much as answer A. Number 3. The nurse caring for a client receiving magnesium sulfate must closely observe for side effects associated with drug therapy. What can be the expected side effect of magnesium sulfate? A. Decreased urinary output. B. Hypersomnolence. C. Absence of knee-jerk reflex. D. Decreased respiratory rate. The correct answer is B. Hypersomnolence. Explanation. The client is expected to become sleepy, have hot flashes, and experience lethargy. A decreasing urinary output, absence of the knee-jerk reflex, and decreased respirations are signs of toxicity and are not expected side effects of magnesium sulfate. Therefore, answers A, C, and D are incorrect. Number 4. The nurse is caring for the client admitted after trauma to the neck in an automobile accident. The client suddenly becomes unresponsive and pale, with a blood pressure of 60 systolic. What should the nurse do first? A. Place the client in Trendelenburg position. B. Administer atropine IM. C. Increase the infusion of normal saline. D. Obtain a crash cart. The correct answer is C. Increase the infusion of normal saline. Explanation. For some clients with trauma to the neck, answer A would be correct. However, in this situation, it is incorrect because lowering the head of the bed could further interfere with the airway. Increasing the infusion and placing the client in supine position is better. If atropine is administered to the client, it should be given IV, not IM, and there is no need for administer atropine IM at present. The answer D is not necessary at this time. Number 5. A 25-year-old male is brought to the emergency room with a piece of metal in his eye. Which of the following actions by the nurse is correct? A. Use a magnet to remove the object. B. Rinse the eye thoroughly with saline. C. Cover both eyes with paper cups. D. Patch the affected eye only. The correct answer is C. Cover both eyes with paper cups. Explanation. Covering both eyes prevents consensual movement of the affected eye. The nurse should not attempt to remove the object from the eye, because this might cause trauma, as stated in answer A. Rinsing the eye, as stated in answer B, might be ordered by the doctor, but this is not the first step for the nurse. Answer D is not correct, because often when one eye moves, the other also does. Number 6. The client is admitted following repair of a fractured femur with cast application. Which nursing assessment should be reported to the doctor? A. Pain. B. Warm toes. C. Pedal pulses rapid. D. Paresthesia of the toes. The correct answer is D. Paresthesia of the toes. Explanation. Paresthesia of the toes is not normal and might indicate compartment syndrome. At this time, pain beneath the cast is normal, so answer A is incorrect. The client's toes should be warm to the touch and pulses should be present. Because answers B and C are normal findings, these are incorrect. Number 7. The nurse is caring for a client admitted with suspected myasthenia gravis. Which finding is usually associated with a diagnosis of myasthenia gravis? A. Visual disturbances, including diplopia. B. Ascending paralysis and loss of motor function. C. Cogwheel rigidity and loss of coordination. D. Worse progressive weakness at the end of the day. The correct answer is D. Worse progressive weakness at the end of the day. Explanation. The client with myasthenia develops progressive weakness that worsens during the day. Answer A is incorrect because it refers to symptoms of multiple sclerosis. Answer B is incorrect because it refers to symptoms of Guillain-Barré syndrome. Answer C is incorrect because it refers to Parkinson's disease. Number 8. The nurse is caring for a client following the reimplantation of the thumb and index finger. Which finding should be reported to the physician immediately? A. Temperature of 100 degrees Fahrenheit. B. Coolness and discoloration of the digits. C. Complaints of pain. D. Difficulty moving the digits. The correct answer is B. Coolness and discoloration of the digits. Explanation. Coolness and discoloration of the reimplanted digits indicates compromised circulation, which should be reported immediately to the physician. The temperature should be monitored, but the client would receive antibiotics to prevent infection. Therefore, answer A is incorrect. Answers C and D are expected following amputation and reimplantation. Therefore, they are incorrect. Number 9. A client with a total hip replacement requires special equipment. Which equipment would assist the client with a total hip replacement with prevention of dislocation of the prosthesis? A. An abduction pillow. B. A straight chair. C. A pair of crutches. D. A soft mattress. The correct answer is A. An abduction pillow. Explanation. An abduction pillow will help to prevent adduction of the hip joint. The client should be taught to avoid crossing the legs. Answer B is incorrect because the client should not flex the hip more than 90 degrees. The straight chair would potentiate the flexion of the hip more than 90 degrees. Answer C is incorrect because the client should use a walker, not crutches, to ambulate. Answer D is incorrect because a hard mattress is best, not a soft one. Number 10. The nurse is assessing a client who has undergone a right lobectomy. Which assessment should alert the nurse to the possibility of internal bleeding? A. Urinary output of 200 ml during the past 3 hours. B. Sanguineous chest tube drainage at a rate of 50 ml per hour for the past 3 hours. C. Restless and shortness of breath. D. Decreased pulse rate and decreased respirations. The correct answer is C. Restless and shortness of breath. Explanation. Signs of possible internal bleeding include restless and shortness of breath. Answer A is incorrect because the urinary output is within normal limits. Answer B is incorrect because the color and rate of chest tube drainage is within the expected range following a lobectomy. Answer D is incorrect because the pulse rate and respiratory rate would be increased with internal bleeding. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.